So how's the new CT scanner an improvement on what can be done previously? Well, the single biggest thing that we can do now is scan limbs standing. Previously, we've had to perform this under general anaesthesia, which of course increases the risk to the patient. Now, what we can do is under sedation, both forelimbs and hind limbs, scan from in the forelimb, the carpus or the knee downwards, and in the hind limbs from the hock downwards in the sedated patient very swiftly. So the diseases which can be diagnosed more effectively with the CT scanner, well, they're numerous. Things that spring to mind are bone-related abnormalities where the detail provided by CT is vastly superior, certainly to X-ray, and with other three-dimensional imaging like MRI, where the slice thickness is greater. So we have more slices going through the limb, more likely to encounter the actual disease process. But also soft tissue injuries, where we can use contrast enhancement to identify soft tissue injuries as well. So the new scanner supports equine welfare primarily by not requiring a general anaesthetic to view the lower limbs. So we can diagnose more conditions more quickly, more effectively, more accurately, and therefore institute treatment more rapidly. A standing CT scan, when compared to a standing MRI scan, the most notable couple of differences are the region that we can scan. So when we scan using MRI, we scan a very localized region, for example, just the foot, and then another scan would be the pastern, another scan would be the fetlock. A scan of the lower limb using CT would include fetlock, pastern and foot in one scan. The other thing which is vastly different is the speed. The speed which we can do a lower limb is around about 15 seconds for one scan, whereas MRI just scanning a foot would take 60 to 90 minutes for a single foot, and obviously we'd normally do both feet as well. So it's vastly quicker and the area we can scan is much greater.